COPD. Let's talk about this. You need to understand this is just not a shortness of breath issue. Now, COPD is a chronic inflammatory destruction of our lungs. It is progressive, it is irreversible, and it causes real structural damage to our lungs. It is made up of two main processes. That is the chronic bronchitis, that is our airway problem, and then the emphysema, that is our alveoli problem. This has different targets, same outcome, that is the trapped air. Let's go deeper into the microscopic areas. COPD comes from the chronic exposure to irritants, usually the smoke. Now this triggers the neutrophils and the macrophages. The proteases are released, the oxidative stress end up rising, the anti-protease defense end up failing, the tissue destruction start happening. And also the chronic bronchitis. Now this is where the airway walls thicken, the globular cells enlarge, the mucus increases, the cilia end up failing, and airway actually start narrowing. This is where the mucus traps the air. Now that's why the cough is chronic and productive. And let's talk about the emphysema. The alveoli walls break down, the elastin is lost, there is no recoil. Now air will enter but it cannot exit efficiently. The hyperinflation starts, and then your surface area for gas exchange drops. The CO2 rises, and then the oxygen also fills. The diaphragm also flattens, the accessory muscles kick in. Personal breathing actually start happening naturally. Eventually, barial chest start forming. Very important. Let's talk about the chronic hypoxia. Now, this causes pulmonary vasoconstriction. Now, the pulmonary pressure rises, the right ventricle strains. That is the cor pulmonale. Now, COPD becomes a cardiac problem if we both leave it unchecked. Let's look at the picture over here. This is a progressive dyspnea, a prolonged expiration, wheezing, decreased breath sound, chronic cough. Exacerbations occur when inflammation spikes up high. This is often triggered by infection. Let's talk about the diagnosis now. Spirometry over here is key. The post-bronchodilator confirms persistent obstruction. Now this is not reversible. This separates it from asthma. Very important. Let's talk about the management. We both cannot rebuild our alveoli. We both can slow the decline. Number one is smoking cessation. That is the major golden intervention that is proven to slow the progression of COPD. Number two is the long-acting bronchodilators. Now these reduce airway resistance. Number three is inhaled corticosteroid. Now these reduce exacerbations selectively. Number four is the pulmonary rehab. Now this improves endurance and quality of life. And the oxygen therapy. Now this is for chronic hypoxia. It is carefully titrated in CO2 retainers. It is very important. Now COPD is a chronic inflammation. There is a mucus remodeling. Also there is the airway narrowing, the elastin destruction, air trapping, gas exchange failure, pulmonary hypertension, also right heart strain. Now understand this very well. You need to control the disease. You just don't treat the symptoms alone. That is COPD. My name is Nurse Solomon, and I'm going to see you soon.